However, what's, I believe, more lacking in academia is, especially health disparities type of work, is ways that we can solve these issues. So we very much highly emphasize policy focused solutions that students can then propose to help reduce these health disparities that they just did all this hard work in identifying. And so every paper we require students to propose solutions, whether that be different community programs that can be implemented from a public health perspective, or policy solutions that can be implemented at the state, local, or national legislative levels. And we also have a network of policy advisors who hail from various elected positions or advocacy organizations or different NGOs as well. And we connect the students to these policy advisors so that they can deliver a presentation about the policy proposals that they would like to see passed.
Welcome to the new mini-series on public health careers, Public Health Conversations, where we'll be digging into more specific topics and expertise with guests on a monthly basis. Super excited to kick off this series with Stephanie Wang and the amazing work that she's leading at the Health Disparities Think Tank, a student-led research to policy pipeline to address health disparities and empower students to pursue research and advocacy in their areas of interest. While in high school, out of frustration of misinformation about the COVID-19 pandemic, Stephanie got inspired to write Epidemiology Unmasked, a youth education, epidemiology, and public health focused book. Did I mention Stephanie was a rising junior at Harvard while doing this interview? Be sure to subscribe and join our email blast for some exciting news in the next week. Link below, and enjoy today's conversation. Stephanie, how are you showing up today?
I'm good. I'm currently in Boston, Massachusetts. I'm living in my dorm at Harvard. I'm doing a summer research internship over at Boston Children's, and also doing some health policy and public health work on the side. So yeah, I'm super excited for the podcast. Thank you so much for inviting me on.
It is my pleasure to have you, and I think people are going to get a sense of like why I wanted to have you on and have you like share about your experience. And I can see that you're keeping yourself very busy this summer.
Yeah, I try to be busy. There's not much time left in college.
But that is true. It does fly by. So tell us, who is Stephanie Wang?
Yeah, that's a big question. Yeah, so I guess the basics. I'm a rising junior at Harvard. I study molecular and cell biology, and I'm pursuing a minor in global health and health policy. I'm originally from Houston, Texas, and I currently reside in Cambridge. My interests mostly lie in two different fields. Firstly, I'm really interested in the applications of stem cells for cancer research, or just cancer research in general. I have a pretty personal connection with why I'm interested in this area and this disease in particular. And then the second big interest that I have is in public health, from a policy and disparities perspective. And both of those very much kind of started around high school. And more so the public health area started around COVID. And I guess for the rest of from COVID until now, I've very much been shaped by those experiences, and then also pursuing research as a pre-med student at Harvard, and also looking into advocacy opportunities to improve public health in all the different ways that I can. In public health in particular, I think my interest did start around COVID, and it was mostly around the issue of misinformation that was burgeoning in my community, especially back home in Texas. And I didn't anticipate, just the sheer amount of misinformation that would be spread during that time. Obviously, I had never been through something to quite that extent, and most of the people around me also hadn't. And because of that, we saw a lot of conflicting information in the news. We saw a very highly polarized society, when I felt that it was really a good time for people to be coming together. And so given that disparity, I decided that, one thing that could be non-polarizing and actually quite uniting would be education, um, especially public health education and epidemiology education. And I thought that, if I was to be in a place where I could help people better understand public health and epidemiology education. Perhaps that can help really improve the world that we live in. And so that's really what catalyzed my interest in public health, was my goal to help reduce misinformation during the pandemic, which I saw was really quite harmful to my community. It was causing a lot of division, causing a lot of unsafe policies being passed, and causing a lot more harm than I thought was necessary. Actually, like much more than I thought was needed. Um, so I could kind of continued down that route in high school, and in college as well. I began working on a lot of advocacy and for health disparities research, working on various health policies as well. So today, I guess my main focus would be to talk about the Health Disparities Think Tank, which is an initiative that I started that is kind of a natural transition from my work in health advocacy back in high school. And yeah, I'd love to kind of dive into that as well.
Yeah. And that is very, very impressive. And I think just to give like the backdrop of you discovering this misinformation in the community and wanting to become an advocate happened in high school. And that was one of the things that really took me aback, because I was like, oh, wow, like she was really getting after it at a very young age, and like really just being an advocate and doing that work. So like even before COVID-19 maybe like came into your life, like what was your experience? Like how were you interested in like just STEM work, or like how did all of that kind of come up for you?
Yeah, so I always knew I wanted to be a doctor from a really young age. Uh, and it was mostly because of my own family's experiences. So I grew up with my grandma and my grandpa over in China for a couple years after I was born, and my grandpa previously had esophageal cancer, but I didn't know that until much later, and I found out basically by asking him why he's always coughing, and it's basically kind of an adverse effect of his surgery. And because of that, he's had a lot of different issues in health issues in particular later on down his life. And I was often there to witness those issues. And I think that was my first introduction to the world of medicine and the world of health. And I think seeing the suffering that he was going through, even decades after his cancer diagnosis, it made me really inspired to go into this field and see what I can do to help improve technologies, especially for cancer care. So that was my initial foray into medicine and why I wanted to go down this route. But I didn't know much about public health and why, and even how it is different from medicine. I think a lot of people still don't know. But I found that out very much in middle school, actually, when I began participating in a competition called the Science Olympiad. It was really fun. It was also a little nerdy, but it was really fun. And I did this event called Epidemiology. Or it was called Disease Detectives, but it was focused on epidemiology. So I began learning about things like how do diseases spread, especially with a big focus on infectious diseases. We looked into foodborne illnesses. We looked into public health campaigns and how we could use them to prevent the spread of foodborne illnesses. We learned about like reproductive ratio, herd immunity, all those big buzzwords that we began hearing about a lot during COVID. And I began learning this, and I really, really loved it. And I um, realized that there's definitely more to medicine than just clinical care. There's this more community focused advocacy element that I really wanted to get involved with. But I never really knew how until COVID happened, and I began seeing all these terms out on the news. I began hearing about them very openly in the public arena. And I thought, okay, many times, if I didn't study this event, I probably would have no idea what people are talking about, and how would I even know how diseases are spread? And I felt that, we really lack in epidemiology and public health education in our school system, since it required me to go out of my way to learn public health in this extracurricular context. So I thought, if I'm in this position where I have learned this material, why don't I take it upon myself to do something to educate people around me, especially those who don't have much background in that field? So I created a book called Epidemiology Unmasked. It's a very intro-friendly book. There's very cute graphics on there. It's meant to be readily accessible for everyone. And I made sure that it was readily accessible by getting my parents, my brother, my friends to read it before I published it. And then after it was published, I was actually very shocked by how, I guess, how popular it became really quickly. I knew that there was definitely a gap in the literature for something like this, but definitely surprised me, how much people were excited to read it. And from there, I began to do public health advocacy on a broader scale. So I began teaching epidemiology and public health to middle and high school students. I created a curriculum that was then implemented in my school. I worked with some legislators to see how we can integrate public health and epidemiology education into the law. So I began towing this very like legal and also political and also health line that began marking what I wanted to do in my career later on. So yeah, that's kind of how I began pivoting more towards the public health side of things. And I do still definitely want to pursue a career in clinical medicine, but I also want to make sure I have a public health focus. So my long-term plan education-wise would be an MD and MPH so that I can pursue both the clinical research, clinical medicine, as well as a more broad community scale focus as well.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at phmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Well, I am rooting for you.
Thank you.
You're most welcome. And I think you highlighted a very important thing is like, we don't learn about public health in our schools at a young age. And you were somewhat privileged to have that experience where you're able to go to this competition and learn about epidemiology. And then the pandemic happened, and then that kind of like framed things to understand like, okay, I was able to get exposed to this information that I think was pivotal and helpful to kind of help us understand what is happening to us right now in this world, and to the point of going and creating a book. And like, once again, not to overstep, like saying that you did this in high school, so that in itself is very, very impressive. And I think it goes to show like how we just need to continue to share public health and expose people to public health, because I found out about public health when I was 23 years old, and I think we need to ensure that people are knowing about what public health is, how you can be involved, how you can get and do different things in public health from a younger age, and just expose it in different ways. So yeah.
Yeah, I appreciate that. I totally agree with you. I think public health is underemphasized, unfortunately, but from my experience, I think public health is honestly the most interdisciplinary field I've come across, at least in my education. It combines so many different elements. Within epidemiology, for example, you get mathematical and critical reasoning, uh, you get population level reasoning, and then within public health, you get definitely the more humanistic side of things, beyond just numbers and science. You get advocacy, you get community based programming. How do you appeal to a great number of people, and how do you provide equitable care to as many people as you can? Sometimes clinical medicine can be a little bit, I think, narrow and a little bit focused on the individual, which has its own merits, but I do think we can't ignore the broader perspective, the more population style of thinking that I really enjoy in public health. That's really how you get the big impact.
Absolutely. And I think it is so important that we have clinicians, doctors, nurses who have that public health perspective, so that while they're still treating the individual, they understand like the broader context of how that work is impacting the population, which is so important. You were part of the competition. You learned about epidemiology. The pandemic happens. You're seeing around you like the misinformation. What sparks you to say, okay, I'm going to write a book?
Yeah, that's a good question. I think for me, I've always really enjoyed writing. Even now in college, I do tons of writing, and I think it's truly one of the most powerful ways that you can make an impact, and also really get your voice heard by the public. So I knew I wanted to always, lean into this writing passion that I've had. But at the same time, I found it difficult to have a big impact if I was to just write articles or if I was to just put out pamphlets online, because I couldn't really condense all the information that I wanted to say in a simple article, or in a simple research paper. And I guess there was also the accessibility issue. Um, a lot of misinformation, actually most misinformation, is transmitted online. And sometimes, in my experience, it feels nice to get a break and, kind of tune out and actually have something physical in front of you that you can read and really learn from. I know for a lot of people, we still prefer traditional books over online textbooks or, online sources sometimes. So I really wanted to make sure that everyone could access it and it was as universal as possible. So that combined with my interest in writing, it kind of led to this idea of why don't I create an intro-friendly book that it's very much lacking in the literature. And this was supplemented by my own experiences in learning epidemiology. Was I would read these epidemiology textbooks and it would take me hours to parse through what they were saying. I didn't know what they were saying because I had no background in the area. And I just wished many times for a more accessible option for me to learn these concepts. So I thought that if I had this sort of textbook available and it explained everything in a conversational lens, I would have a much easier time learning epidemiology than to pick up like a 500-page textbook and try to read it overnight. So that was my inspiration. And I think I mentioned this earlier, but I wanted to make sure that everyone could read it and everyone could truly understand what I was saying. So my brother at the time was 12, and I'd ask him to proofread it and make sure that like he could understand everything that I was saying and that I wasn't using big words that was kind of just detracting from the main point of the topic. So the key was accessibility. And from there, I made sure to use graphics that were visually appealing, that made the reader have a good experience. And central to the message was this outbreak investigation journey that takes the readers through the shoes of an epidemiologist who's investigating an outbreak. And I think this sort of investigational, experimental style of learning is something that makes the book more fun and more unique. So yeah, that's kind of how I got the idea and how I put the project to action. And then after that, I wasn't planning on doing all of the supplemental things. I thought, why don't I just promote this book? But then I realized truly how much need there is to provide this public health advocacy in a public forum and talk to people like teachers, talk to people like legislators who may not know that there is this need in the education system to supplement public health learning. And from there, I created Project Unmasked, which became this campaign that I ran to provide public health education in schools. And then I've really, really found it so fun to write curricula on public health, come up with all these cool scenarios for students to learn about epidemiology and other concepts in this big and interdisciplinary field.
Well, thank you for sharing that. And I think it underscores the importance of accessible information. And too many times we get caught up in trying to be as academic as possible.
Yeah.
And when we're really trying to meet people where they're at, we need to give them information that they can really understand. And I think to your point, like, how do we get rid of the big words that aren't really giving much to the conversation and helping people learn things, as well as how do we develop a story that people can kind of like follow the journey and learn while doing that. And thank you for highlighting that your brother was 12, because that also helps us to understand the proofreading process. But like, as they say, you should be writing to someone that's like at a grade 5 level. And I think that's very important and oftentimes missed in public health communication. So I'm glad that you were able to identify that and really be able to like hone in and create this entire project. And then from that, build out and do a lot more work around public health and advocacy, which I think is phenomenal.
Thank you.
Yeah, you're most welcome. And I would link the book below. And if anything else you want to share with me, I will link it below or in the show notes for anyone that is interested in that. So wanted to switch gears a little bit and talk about the Health Disparities Think Tank, which is a multidisciplinary student-led research to policy pipeline affiliated with leading hospitals, advocacy, and governmental organizations. So I will open the floor and I will ask questions as they come.
Yeah, definitely. So again, thank you, Omari, for highlighting this HDTT, which is my most recent endeavor. It's crazy to me that the book and all of Project Unmasked was started about 4 years ago during 2020. And since then, obviously, a lot has changed. COVID has pretty much waned, but the movement to keep public health alive and public health education ongoing is definitely still very pertinent. And I think in high school I had a pretty narrow view of the world, and in public health, I think many high schoolers generally do. Uh, but it's as you get older, you definitely see more of the world and you see more of society and more of the things that you want to improve in the world. So after I went to college, I'm still, after I came to college, I began working as a nursing assistant at a local hospital. And I began pursuing a variety of other medical related extracurriculars that gave me a very firsthand insight into what the healthcare system looks like and how it functions on a day by day basis. And what genuinely could not escape me was the sheer amount of disparity that remains present in our health system. Um, so many that, if you just Google like health disparities, you'll find disparities along socioeconomic lines, racial lines, ethnic lines, um, health literacy, educational level, country of origin. There's countless ways that disparities manifest in today's world, unfortunately. And to me, I felt like there wasn't enough that was being done to address these health disparities. Yes, there's been so many promising efforts, so much research has been put into this, but it's genuinely, in my opinion, not enough. I think a lot of the times research into health disparity is overshadowed by some other types of research that kind of comes to your mind immediately when you think of research. So like pipettes, um, you know, uh, TC hoods, which I love. I love wet lab research. I'm in a lab myself, but I think oftentimes we also need to pay attention to health disparities and how we can help improve health disparities by performing more data-driven analysis and research into these areas. Um, and I noticed that many of my friends in college, they weren't necessarily being provided with as many research opportunities and advocacy opportunities to help reduce health disparities as they wanted or as I wanted to see within students. So I decided to put together this group where we could match students with mentors and students could work on their own health projects combating health disparities based on their own passions. So oftentimes students are drawn to a particular disparity because it very much speaks to their own identities. For example, if a student is from a marginalized community, they may be more interested in exploring disparities affecting their marginalized group that they belong to. Oftentimes, if a student has family members afflicted with a certain type of disease, like cancer, in my case, I am more interested in disparities that affect people with cancer. So, what I wanted to do was to make sure that students are empowered to pursue exactly what draws them to this field of health disparities, and we can match them to the resources that they need to do this kind of research and followed by advocacy of the results that they determine. So basically, the workflow is that we have right now about 40 or so students from all across the country, actually hailing from 11 or 12 states, and we put them into groups to do research into areas that particularly interest them. So, for example, we have projects looking into reducing racial biases in AI and radiology. We also have a project looking into rates of cancer screening among Asian Americans, especially Asian American immigrants, and why these screening rates for cancer are so low. We have another project looking into climate change health effects on undocumented children. So very, very, very niche topics that are often underexplored. So students work together in a group. They create this, they do a very, very thorough literature review. They put together a paper that then we use to match them with a mentor. And we have a pretty wide network of mentors from a variety of different hospitals, NGOs, universities, etc. And these mentors are super highly skilled in their fields, and we match them to the projects that we think best fit their expertise. And there is very open dialogue between the students and the mentors on how we can improve their existing project, potential methodology, ways that we can improve. And then ultimately the goal is to have a publication that can then be disseminated for the students into the broader literature. But we want to make sure that we don't stop there, since that's where most research stops, is that academics, they tend to sell the problem very well. They tend to have all these really great statistics that are very convincing that tell you this is what's going on and this is a problem. However, what's, I believe, more lacking in academia is, especially health disparities type of work, is ways that we can solve these issues. So we very much highly emphasize policy focused solutions that students can then propose to help reduce these health disparities that they just did all this hard work in identifying. And so every paper we require students to propose solutions, whether that be different community programs that can be implemented from a public health perspective, or policy solutions that can be implemented at the state, local, or national legislative levels. And we also have a network of policy advisors who hail from various elected positions or advocacy organizations or different NGOs as well, and we connect the students to these policy advisors so that they can deliver a presentation about the policy proposals that they would like to see passed, including, if they're talking to an elected official, different legislation that's currently being considered in the legislature that they would like to see them sign on to. And this way they can actually follow up their research with actionable policy advocacy, and so that they can play a role in helping to reduce these health disparities. And this is a very firm belief of mine as I was putting together this organization, is that students should have the entire experience from research to advocacy in order to ensure that what they're doing genuinely feels like they're making an impact. And that students do feel empowered to pursue exactly those disparities that they are driven to pursue, either whether it be based on personal interest or personal belonging in a particular minority group. So yeah, that's kind of the gist of the Health Disparities Think Tank and why we were formed and what we do on a day-to-day basis. Right now we have 6 projects that are ongoing in our summer fellowship, and previously we had a couple more that explore things like drug prices, especially in cancer drug prices, and shared decision-making strategies to help improve HIV patient care. So very broad range of projects, and we're always trying to recruit for more students, recruit for more mentors, recruit for more policy advisors, and this way we can really grow our network and our very unique model of making change.
Thank you for highlighting a lot of that. Before I dig into like more logistical questions of it, I think it's so important, and I wish there was an organization like this when I was in school where I can like contribute to research that interests me in a group manner, and also like have experience of like building out a research paper that has the ability to like apply to get into journals and those kinds of things. And I know that y'all are working on a journal as well internally, and we'll talk about that in a bit. But I also like the point of like, let's not just research the issues, let's not just highlight the disparities and the data and what it says, but what are some of the solutions that we think can really be implemented. And oftentimes I think that is where public health fails in itself. It has the data, but it doesn't do much of the policy advocacy type work. It doesn't do too much of the implementation side and pushing into that work. So I think it's so important that we always frame not only like, hey, these are the health disparities, these are the things that are going on in community, but here are the solutions. And I'd imagine that as people continue to do this, we will get more refined solutions, we will get broader perspectives. And I think it's also important that we're having students give their perspectives on it as well, because it gives a fresh lens into a lot of issues that have essentially existed for decades in many circumstances. So I think like just having new ways to get perspectives on this research is helpful. And I'm very, very excited for the work that you all are doing. And like once again, I'm honored to be here and chat with you, because I think in the future you might be the Surgeon General for the US or something of that sort.
That's so flattering.
It is true. It is true, and it is. I don't know. You embody a lot of things that I think a Surgeon General should have, and both on the clinical and on the public health perspective of things. So we'll see how your journey unfolds. But regardless, I think you're going to do amazing work.
Thank
Um,
you. That's so
you're,
kind.
you're most welcome. But jumping into like some of the logistics, you said you all have 6 projects going on right now. You have a summer
Mhm.
cohort. So tell us more about, you all are always looking for students, I'm guessing, to get recruited in. So what does that process look like? How long does a student work with you all? What does that all look like?
Yeah, that's a great question. So with regards to recruiting students, we started, it's a very, very new organization. We started this back in April. So it's been a couple months. And we're very, very honored to have created a big network within these few months. So I would say the biggest challenge that I've experienced thus far with creating this organization was having to select students and say no to some students. Because we genuinely, right as of right now, we're still building up the organization. We don't have enough resources or enough capacity to support every single student in doing being a part of a team and doing a project. So when we sent out applications, we got way more applications than we could select, unfortunately, and it was such a sad feeling. And as someone who has applied to many things and gotten rejected from many things, it was very interesting being on the other side and seeing, like, genuinely, this is just so it's just so sad that we could not accept as many students as we could. um, but yeah, that we had our first cohort this summer, and we're planning on doing recruitment in the fall, in the spring, and then next summer as well, and ongoing into the future for as long as possible. And so students, when they apply, we just ask them to talk about, what are some health disparities that particularly interest you or particularly speak to you. And then we ask them to submit us their resume, writing sample, very standard protocol, things like that. And then a couple essays just about like working in a team or leadership. And then we read through every application. We try to interview as many students as possible to get a feel of what they're interested in. And then when we're designing the projects, we try to incorporate the cohort's interests as much as possible. So this cohort, for example, we had many students interested in climate change, and that's not very surprising given that climate change will disproportionately affect younger generations like our generation. So we made sure that we had a project specifically tailored towards climate change and ways that we can address climate change, especially for marginalized communities like undocumented immigrants. We also have students from different schools, different states as well. We tried to pub to different schools because we did start as a club or kind of as a group of Harvard students. We tried to also reach out to different students within our school and then to friends who attend other schools. But unfortunately, our reach wasn't too broad back then. And in the future, we definitely want to increase our reach and our advertising to as many schools as possible. And then with regards to mentors, I looked into people in neighboring hospitals who were very experienced in conducting all types of health disparities research. And I honestly just contacted people who I thought would be a good fit for a program. And I was also very surprised that mentors were typically very willing to join even in the very initial stages of the organization. And that was very, very encouraging for me, and definitely a big support for growing our organization. And with regards to policy advisors, we also have a dedicated policy team who helps research fellows curate their policy recommendations, as well as finding legislation, for example, that they can talk about and promote in their meetings with policy advisors, and also reaching out to different people who we think would be a good fit for the advising the policy component of our program. So that's kind of how we recruit students, and we're also trying to increase the number of people on our board so that we can accommodate more teams and accommodate more students and ultimately more researchers, and provide more students with this opportunity to experience both the research and the policy side of advocacy.
So I'd imagine that with the growing interest as you'll continue to do work, you're going to get a lot of students applying. What are some of the
Mhm.
things that kind of stand out to you all when you're
Mm.
looking at student applications?
Yeah, I think the biggest thing that we want to see within students is passion. Many of our students who we ended up accepting, they had a very deeply personal connection to a particular health disparity, and we're very obviously driven to help to combat that disparity. For example, some students, like I mentioned, they are interested in disparities in a particular disease because perhaps they've seen a loved one suffer from this disease, or students from a particular minority community who have firsthand seen members of their minority community suffer from these health disparities. We also try to interview every single applicant, so that we can hear directly from them why they want to join and what inspires them about combating health disparities. So I think above all, we want to see passion. Other things we typically like to see in students is definitely a good skill set in writing, since a lot of the research component is trying to sell, kind of trying to figure out exactly how to kind of present the problem in a way that is understandable to as many people as possible. So we do ask for a writing sample, and we want students to be able to work together and work collaboratively to produce this final, well-written deliverable. Also, students who are able to commit the time and energy needed for the fellowship. It does end up being a bit of a time commitment for students, especially since we're operating on a relatively short time scale of one summer, especially for the summer cohort. So we do make sure that we recruit students who are dedicated and able to commit the 8 to 10 hours that we expect of them, and also continue on with policy and do basically the entire fellowship from start to finish, since it does tend to be a little bit challenging for students who may have, you know, 15 other commitments lined up at once. Um, so yeah, honestly, we are super open to any student background, any interest, anything like that. We just want to see mostly just passion and commitment. Um, and we believe that things like a strong writing, those can be trained so that you don't have to come in being like the best writer ever, the best researcher ever. We do try to provide you with all the resources that you need to succeed in our fellowship. So we also do really like a very diverse class of research fellows. We believe that, you know, within diversity, you can hear very new perspectives that you otherwise wouldn't have heard. And we very much like to think of our fellowship as a very tight-knit community where we do get to hear about what people's interests are and jump ideas off of each other to promote our own research.
Oh, well, thank you for sharing that. And just for clarification, so students at what level are able to apply and be part of the cohorts?
Yeah, so as of right now, most of our students are undergrads, but we do have some students who are in master's programs or graduate programs, or are attending medical school or are about to attend medical school. So we definitely don't restrict. We've also had some students apply in high school. So anyone of any age, um, we just want to see, like I said, the passion, the commitment, the dedication to health disparities research, and also being able to commit the time. So yeah, we also welcome students from any geographic area. Could we have a student? We have students from across the world actually. So yeah, anyone who's interested, we'd love to support them as well. And again, we're also growing our network and growing our number of initiatives that we'd like to get started. So the next initiative, we'd also like to support students with potentially independent research if that's something that they're interested in, as well as promoting them to higher levels within the organization. So you start off as a research fellow, you can get promoted to being a project lead, and then a project lead, you can be promoted to a board member. And this way, students get, you know, the entire experience of being within this organization.
So I wanted to hear a little bit more about the journal that you were working on, and I know that you in our conversation earlier you were talking about like indexing the journal. So just walk us through that and like why are you all thinking about doing this?
Yeah, so we want to make sure that students can get their work out there no matter what, given that their hard work should pay off within this fellowship experience. So we also recognize that a lot of the times, you know, peer reviewed journals, that process can be really lengthy and can be very selective and very competitive. And oftentimes they have pretty rigorous expectations for formatting or for the number of authors or for word count and things like that. And so we definitely try to encourage students to submit to peer-reviewed journals as much as possible, especially for the initial run. But we also recognize that sometimes it can be challenging, and sometimes students may not have the time or the ability to follow through with this full lengthy peer review timeline, especially students who are about to apply to medical school or apply to certain postgraduate plans. So we also have internal, actually internal is not the right word. It's called the Journal of the Health Disparities Think Tank. It's a publication that we started as an initiative of the board, and we support students who choose to publish in our journal, and we have it indexed with Crossref, which is one of the DOI indexing companies, so that students can, if they decide to publish with us, they are also kind of contributing to the scholarly literature on health disparities, and that we're also in the process of making different volumes of the journal, different issues of the journal, and we're working on disseminating the work as much as we can, potentially collaborating with other journals and other organizations to help disseminate the work that students produce. So this is just to ensure that students, their hard work will not be, it won't be, I don't know, wasted is not the right word, but it will be uploaded and seen by other people out there. So we do, like I said, try to provide as many resources as possible to students, whether it be mentors, resource packets on how to perform this type of research, a wide network of policy advisors, and our most recent initiative is the journal to make sure that students have the entire publishing experience.
Well, Stephanie, you have your hands full with this Health Disparities Think Tank, being a student, and all the other things I know that you have going on. Is there something about the Health Disparities Think Tank that I didn't ask you that you'd like to share about?
So yeah, the last thing that I wanted to mention is that we also want to grow HDTT into as national or if not international of an organization as possible. So right now, most of our partners are Harvard affiliated. So many of our research mentors are from local Harvard affiliated hospitals such as MGH, Brigham and Women's Hospital, Dana-Farber, et cetera. But in our long-term and short-term goals, we want to see more mentors from places across the country, especially with representation in different hospitals in serving minority regions or advocacy groups, especially dedicated to combating health disparities of various minority groups. So that's definitely a goal of ours, is to help expand. So if someone's listening and you are from a minority serving hospital or from a hospital or academic institution that we're not currently affiliated with, we'd love to keep in touch, get you on board, and potentially work with you to help provide this resource to our students. As well as students from, underserved communities, we are definitely open to any background as long as, like I said, there's passion and commitment. So I'd love to, also take this opportunity to speak to listeners who may be interested in getting involved, and open that floor to you and let you know that we are more than happy to collaborate.
Well, thank you for sharing that. I wish you the most success in this and all the endeavors that you have going on in your life.
Thank you so much, Omar. And thank you so much for offering me this platform.
It truly, truly is my pleasure, and I'm looking forward to seeing how everything grows and how your career moves going forward.
Thank you. And it was definitely a pleasure speaking with you today as well.
Yeah. And before we end the show, I wanted to just have like a favorites section. So just kind of highlighting what's something cool you recently. It could be a movie, it could be a show, a podcast, something you saw on social media, or something you read or watch. If you don't have something, I had a more specific question I think you might be able to answer.
Um, yeah. Let me think for a moment. I think you should go with the more specific question. I probably need to think a little bit for that.
Yeah, no problem. So I went to your LinkedIn profile, and in your summary section, you say that you have an avid love for coffee shops.
Oh,
So I wanted
yes,
to
yes.
so I wanted to know if you had some recommendation for some coffee shops
Oh my
in your
gosh.
region that you
Yes,
sit next.
that is such a good question and definitely hit the nail in the coffin there. But there's a place in Harvard Square called Blank Street Coffee, and I go there so often. It drains my bank account, and it's a really bad habit. But um, another thing is that I've been trying to kind of wean off of caffeine so that when I need it, it really works. So I've started drinking decaf coffee, which is like the same thing, but it still drains my bank account. Um, so yeah, we're trying to improve on that habit.
Awesome, awesome. Well, shout out to Blank Street Coffee. I hope that you you can find ways to save on coffee. But I appreciate you coming on today, and I appreciate you sharing your
Thank,
insights and your journey with us today. Thank you all so much for tuning in to this new version of the Public Health Careers podcast, where I really dig deep into a certain topic with a guest who I find is fascinating. And I'm really, really glad that we were able to chat with Stephanie today. If you have not as yet, be sure to subscribe. Be sure to share this with a friend. Be sure to leave a review. Much appreciate you all, and see you all next time. Bye, everyone.